Hello, everybody. Happy good evening, good night, or good morning, depending on when you're playing this video. Welcome to the Lyman Conference. I'm sorry we're not in person. Mr. Schallenberger has asked me to come back and teach once more, which I'm very ecstatic to do because I kind of love this conference. And this time we're going to talk about autism spectrum disorder and what it means to you as the EMS provider. Let me get rid of my mug real quick. Then you get to hear my beautiful voice so you're not distracted. Um, I am Daniel Wesley Brookshire. I am a clinical education specialist down here in Colorado Springs, Colorado for American Medical Response. Um, I absolutely love autism. It's one of my favorite topics to speak on. So let's go ahead and get started. So to begin, the point of this class is we're going to see how we can identify or what is autism spectrum disorder, and then how do you identify your patient with autism spectrum disorder. We're going to hit some treatment thoughts. I've got some resources for you. Originally, this slideshow has some awesome videos that go along with it. However, due to the power of YouTube and copywriting, I went ahead and removed those so none of us get in trouble. But I would happily point you into some directions with that. So definitely sit back, enjoy, listen, and we're going to talk about autism for about 30, 45 minutes, okay? So autism is autism spectrum disorder. And when we talk about spectrum, I want to really touch on that word, my friends. Spectrum is a range of neurodevelopmental disabilities. Just because you have 1, 2, and 3, or X, Y, and Z, doesn't mean you can't have Q, R, S, and X, maybe Y, some of Y, a little bit of Y. It's a range of neurodevelopmental disabilities. Vaccines do not cause autism. There is no proven medical whatsoever correlation between autism and vaccines. In fact, the doctor that made that claim is no longer a practicing physician, just so you're aware, because autism is a lifelong condition. It is for life. You are not just going to stop having autism one day. There is no cure for autism. There's ways to treat it, but there is no cure. Patients or family members or friends are born with autism. The number of diagnoses is on the rise. And I want to stop real quick and make a note of why. It's not because we happen to have more people with autism, even though our population is booming and growing, but it's because we have better tools to diagnose people with autism spectrum disorder. Remember, in the 80s, 70s, 60s, if you had autism, you lived in a sanitarium your whole life, or you could have. If you had severe autism, you could live in a mental hospital because people didn't understand what it was. And this practice happened into the 70s and 80s. So the CDC, the Center for Disease Control, estimates about 1 in 110 children will be diagnosed with autism. Now, this is more common in men than women. However, as a healthcare provider, listen to me and listen to me good. Women can have autism as well. Don't ever say, oh, it's so rare that you have autism because you're a woman. Oh, I didn't think women could have that disease. I didn't think a girl could be autistic. 100% they can have autism spectrum disorder as well. So please, 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 pretty please with sugar on top, keep that in the back of your mind, because females can have autism. Sorry, I was sipping on the Red Bull, kids. So when we're talking about autism, we look at it in a spectrum. We look at it as a rainbow. Roy G. Biv, red, orange, yellow, green, blue, indigo, violet, or indigo, as we like to call it in the South. So let's start with our high functioning folks. These patients need support. They'll need some social and communication skill development. And remember, the development normally comes from the world of psychology or neurology. Sometimes speech therapists, physical therapists, occupational therapists also work with this patient population, but a lot of times it's overseen by a psychologist, psychiatrist. And they do have some repetitive behaviors, but they are only only noticeable without support. So this patient, this level 1 patient, can totally be functioning 100%, have no issues, and you wouldn't even know they had autism until they told you, especially if they received the support as a child or as a teen, adolescent, even as a young adult or an older adult, that helps them keep their repetitive behaviors in check. Now, level 2 autism patients, these will need substantial support. These patients will need help with their social and communication skills and repetitive behaviors as well. Um, it's pretty obvious to the casual observer that this person has autism because they have some kind of repetitive behavior that shows them. For example, they have to open a door, but to open a door, they have to twist the knob 45 times or 5 times. And yes, that may sound like OCD, but not necessarily. And sometimes those can correlate with each other. But usually, this patient has a ritual and they like to stick to it. I want to point out social and communication skills. This is where patients with autism really struggle. They don't understand what we call, quote unquote, and I'm doing air quotes even though you can't see me right now, societal norms. They don't understand why we say good morning, thank you, please, how are you? To an autistic patient, it may be like, why do I have to say thank you? I ordered this. The person brought it to me, even if it's my mother or a waitress or waiter. Why do I have to say thank you? This is part of our service trade, even though it's polite social behavior, especially if y'all in the South, you say thank you if somebody sneezes. So those are the social behaviors we're worried about. Communication skills can be as severe as the patient doesn't talk to the patient doesn't talk unless they are asked a direct question. Even if they're asked a direct question, they may wait 5-10 minutes to answer it because they're thinking of how community standards would need to answer this question. Then this leads us to our severe autism patient. These are our level threes. They will need support their entire life. Some of these patients do end up in group homes. Some of these patients end up in long-term care facilities like skilled nursing facilities, nursing homes. These patients will have some kind of caregiver their entire life because their communication social skills are so delayed. They'll have repetitive behavior so severe it impairs their daily life. And we'll get into that repetitive behavior in just a minute. But these patients may have a caregiver their whole life. Their parents, who are their caregiver primarily, may die. They may outlive their parent. Autism doesn't necessarily stunt your life cycle. So definitely keep that in mind. Imagining being a parent of a person with autism and they're severely autistic. What if I outlive them and somebody takes advantage of my child? That'd give somebody some anxiety, right? So keep that in mind. So, some common signs of autism in children, but even common signs of autism in older adults. By 6 months, if your child didn't have a big smile or joyful expression, that would kind of bother you. What about 9 months, no communication through sounds or facial expressions? Those things would bother you. 12 months, what if your child had no babbling or no hey, ba 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 ba, and you're like, whoa, why are we not talking back and forth, or why are we not pointing at our bottle? Why are we not smiling when I say hello? When mom walks into the room or dad walks in the room, that child should be focused on mom and dad because that's their whole world at 12 months. By 16 months, no words. So a lot of you have children. We're EMS for good Lord's sake. So a lot of us have children. That's part of our MO, right? So not having a child at 16 months who can communicate with us, that would be concerning or disheartening. By 24 months, no meaningful 2-word phrases. Now, I pulled these off of something called the MChat. So this is the modified checklist for autism in toddlers. It has been revised, and we'll look at that next. But the MChat is where we really started a good foundation of how we're going to diagnose patients with autism. Now, the MChat R, so this is the revised edition, has a lot of more in-depth ideology. For example, does your child play pretend or make-believe? Have you ever wondered if your child was deaf? Does your child like climbing on things? Does your child make unusual finger movements? And that's not flipping the bird to mom and dad near his or her eye because that's their form of communication. So those are all very unique individual things. Our child should be playing make believe. Our child should be trying to climb on things. Our child shouldn't be making unusual finger movements. And I just foresee somebody flipping a bird to their mom and daddy, and that's not usual. Yes, yes, I know. God love my rednecks from back home. So some other signs that we see in adults that we need to really bring up is an adult that avoids eye contact. Doesn't mean they're shady or evil or rude or stealing or the criminal or crook. Maybe they have autism, and that's something I really want you to comprehend today. This person may be autistic. That is why they are avoiding your eyes. Um, does the patient you're dealing with stare at the lights, ceiling fans, or hands? So you're sitting in the back of the ambulance and they stare straight up at the lights and they won't look you in the eyes. And you're like, what in the good Lord is going on? I don't understand. Back to our younger population, but even sometimes our severe autism population, we'll see prefers dangly things to toys. So dangly earrings, that's one of the other reasons we shouldn't wear dangling earrings in the ambulance or in healthcare in general. But also look on scene or talk to the patient. What if they're carrying a dog toy? A lot of persons with autism, older, severe autism patients, but especially children, it's not safe to have baby toys, toddler toys. Those are not safe toys for them. Plus, they don't like them. They're fluffy, they're big, they're ugh. Instead, a lot of patients and parents with children with autism look at dog toys because they have tactile senses. They're easy to chew on. You can't swallow them. Swallow, that is a word. Swallow them. So those are things to look at while you're on scene of a call, or look in the patient's bag. They have a whole bunch of dog toys, and you're like, well, that's weird. Where's Fido? Fido ain't there. Jim Bob, which is what we always called our dogs, he ain't there. The toys are for the patient because they're very tactile stimulation toys. Look for repetitive body motions. And I'm going to turn my camera on real quick, and I'm not trying to be funny here, but if the patient's doing this 5 times and then 5, or it has to go, that's repetitive motion. That's definitely something we want to look at. That's something we want to be cognizant of. As long as it's not hurting you or the patient, don't interrupt the repetitive motion. It's a form of communication. It's a form of stim or stimulation. Stims are very important to the patient with autism because it's their form of communication. So maybe slapping their chest 5 times says, hey, I'm here, listen to me. Hey, slapping our stomach or rubbing our stomach in a circle for 5 times, maybe like, hey, I'm hungry, it's time to feed me. Come on, humans, listen. Get it? Fun, right? Unusual vocalizations. And when we talk about unusual vocalizations, we're talking about we're all sitting there watching a movie and then out of nowhere, woo, or huh, weird vocalizations. We're like, where did that come from? Those are completely forms of communication. Once again, called stimming or stimulation, forms of communication. The patient is trying to communicate something. You may not get it. Mom and dad, brother, sister, they might get it. They're like, hey, he makes that noise. It's totally cool. This is what it means. He wants Blue's Clues on. Let me go get some Blue's Clues. We'll all be good. So definitely try to seek out the caregiver to understand those vocalizations. And then we get to inappropriate laughing or giggling. So we at Mama Methuselah's funeral, and everybody's dressed in black, all teary-eyed because Mama Methuselah made the best hog jaw and biscuits in town, right? So everybody's really upset. And then out of nowhere, there comes a ha as we get to the pall pit where the coffin is, and you're like, oh my God, somebody's laughing at the funeral. They done lost their mind. They go into the loony bin. No, this is a form of communication. The person is in such an intense situation, they need a relief. So don't think it bad of them. They had to react. Or you're transporting a patient who has a broke arm, and instead of crying, screaming, hollering, they're giggling. And you're like, oh, this is so weird. Why are you giggling? This is stressing me out. Oh gosh, it's not because they possessed by the devil. No. This patient's trying to communicate, and that's the best way they know to communicate. As a human race, when we smile, we like to smile back, and that's a big thing in America, especially the South. I mean, you may not have all your teeth, but it's something you got. So if someone doesn't smile back to you, consider that, oh my God, something's wrong. They don't like me. Oh my, they hate me. Don't stress. That's normal for a person with autism because they don't understand the social cause of it. So definitely keep that in mind. Persons with autism love to spin objects. And when we talk about spinning objects or even themselves, they may spin a bottle so much that the wood on the floor has a divot in it, or the glass bottle has actual damage to it because we've spun the bottle so many times or spin the toy so many times. So those are very good signs of autism. If a person doesn't want to be cuddled, I'm going to be devastated because I'm a cuddler. I'm a big dude. I like to cuddle. I get cold. I get scared. It's 3 a.m. There's somebody attacking me in my sleep. I need to cuddle so I feel protected. My poor dog, God love him. Thank God he loves it. So, I mean, cuddling is a big part of human culture, especially American culture. So imagine if a patient doesn't want to cuddle. Even worse, imagine if your child doesn't want to cuddle. So those are things to keep in mind. Now, on the scene of a call, there's some really cool things that we can look for. Some of those things that we can look for are seatbelt signs. Sometimes a patient will actually have sewn into their clothing a puzzle piece. Puzzle pieces are big for the autism community. It's because we're building up those pieces to fit back into society, building up to learn. So when we say may resist help, may not recognize danger, at risk of wandering, we are serious about all three of those things. May resist help. So instead of running towards you because the house is on fire, persons with autism may run towards the house. Instead of running towards the lights and sirens, they may run away from the lights and sirens because they're loud. So those are things to be scary of. And when we say at a risk of wandering, people with autism need to be reminded 100%. If you're dealing with an autism patient, that is somebody that you need to keep physical eyes on at all costs, especially the lower functioning to mid functioning class. Those patients can disappear and you find them 5 miles down the road at a jig and reel. And you're like, what in the good world? How'd you get here? Well, I walked. Persons with autism are very observant to the situation. So they don't feel comfortable. They'll go somewhere they feel comfortable, or they'll just wander away. They'll wander because they're exploring their settings and surroundings. Now, there is a part of autism, and there's a big debate in the community about this: Asperger's classic versus autism spectrum disorder. Some people consider Asperger's a milder form of autism spectrum disorder. Some consider it a different process disorder. But for the most part, we do fall under the autism world when we're talking about Asperger's. The major differences: Asperger's does not affect communication and language skills as much as classic autism spectrum disorder. That doesn't mean it doesn't affect them, guys. That doesn't mean there's not a Roy G. Biv, that red, orange, yellow, green, blue, indigo, violet level of complexity there. Now, people with Asperger's, especially children, they will struggle to make those relationships, but they'll be able to do it much more at ease than someone with traditional autism spectrum disorder. Now, on the right side of your page, there's some special talents that we need to talk about. And yes, they are generally 100% with persons with Asperger's. However, patients with autism can also have some of these talents, let's say. They could have a unique sense of humor. So some of the horrific jokes that you tell each other in the front of your ambulance or fire mobile can 100% be considered a unique sense of humor. Or they tell jokes about mathematics. Who tells a math joke? Come on, guys. 1+1 = 5. No, it doesn't. It equals 2. And you're like, oh, funny. Great. Thank you. So keep that in mind. Brutally honest. Someone with autism spectrum disorder or Asperger's can definitely be honest to the point of brutality. Does this dress make me look fat? Well, yes, but you always look fat. Oh, well, thank you. I'm thick in the hips. That's it. I ain't fat. Thick with 2 C's and 2 K's. Persons with autism and Asperger's may have a severe desire to connect because they do feel isolated from the community. It doesn't matter how different our developmental world is, we all want to be a part of the greater good. Maslow's hierarchy of needs are still in play, my friends. So there is a desire to connect. I do want to note, with desire to connect, a lot of people try to scam persons with autism, high school all the way to college. Hey, we're having a party. Do you want to throw some money into the pot for, I was going to say pot since it's Colorado, but let's say beer. Oh, yeah. How much is appropriate? Well, as much as you can give. Well, I can do $500 to charity this year because I invested this much money. So here's $500, which is totally inappropriate and disproportionate. But the person asking for that money, if they're not brutally honest back, could take advantage of that person. So persons with autism do have to be very conscientious about money, about where they are in the world, what they do. So fair and just to the point. Oh, I'm so sorry, guys. Fair and just to the point of black and white. When we talk about fair and just, murder and jaywalking are both crimes. Why do they not have similar punishments? Um, Fair and just can be a little extreme, but that's just another example of social interactions that are really hard for a person with autism spectrum disorder. Fair and just is really, really hard for people to understand, comprehend, and use. Intellectual special interest. This is the one that is most common in most persons with autism. They have some kind of special interest. And this is a key for you as a healthcare provider, my friends. If you, as the healthcare provider, can get them talking about their special interest or showing you their special interest. So let's say you walk into their house and they have 35,000 dinosaurs all over the floor, stickers all over the wall. And you're like, I bet y'all like some dinosaurs. Well, hallelujah. Tell me all you can about dinosaurs. Not only can that person probably tell you about the mating habits of the Jurassic period dinosaurs versus the mating habits of this and the dietary habits and how dinosaurs probably had feathers versus scales, they can go into minute details that you're like, oh my God, please shut up. Here's the cool part. If they're focused on them, their special interest, you normally can do a full assessment. I've used this to my advantage and started an IV on a person. They didn't know I stuck them. So special interests are something that are definitely very important in the autism world, as well as it's a trick for us. If Barney the dinosaur's everywhere, hey, I love you, you love me, let's sing it 45 times and get to the hospital, please. So definitely make that your advantage. Memory, there is definite interesting debates and research in memory from infancy, in memory from first week of birth. Persons with autism may have such good memory, they can remember what you had last year. On the third day of February, you had the turkey salad sandwich, which you've had 45 times over the past 6 years on your bi-weekly lunch dates. So, and you always get no tomato because it makes you sick, and you tell them it's your allergy, even though you're lying, you have no allergies noted on your medical record. That's how good and detailed their memory may be. That doesn't happen to all. All of these may not even be a part of the person with autism, but these are common strengths that you may find. Focus and attention to detail to the point of it can become dangerous. So think tanks or places that work with patients or persons with autism, school labs, sometimes they have to designate somebody to be the safety monitor, and it may be a person without autism or an aide. So, hey, you need to go shower. It's been 5 days you've been working on this project. Hey, there's a fire. We have to evacuate the building, but I'm focused on my project. I don't care. There's a fire. We got to go. It all stops now. So focus to the point that they don't even understand what's going around them. And detailed oriented, it makes Excel look like nothing, my friends. Excel is POS compared to a person with autism. Some famous folks with Asperger's: Susan Boyle, Courtney Love, Daryl Hannah, who's one of my favorite actresses of all time. She was in Steel Magnolias, if you don't know. Dan Aykroyd and Anthony Hopkins. So Dan Aykroyd is one of my other famous loves of my life. And Anthony Hopkins, that's Hannibal Lecter himself. Hello, Clarice. Lava beans. Anyways. But I want to point out Dan Aykroyd for a minute. One of the reasons he's in comedy and plays music and tries to make people happy is because it helps him understand emotions. If any of you know who Courtney Love is, I know you're thinking, no, that's just cocaine. No, Courtney Love does have autism in a sense, or Asperger's syndrome. So definitely keep that in mind. This one on the right, we'll talk about in a minute, but on the left, this is a patient having a overwhelm or a meltdown, or they are so sensory overloaded. Now, I want you to take a thought. Think of your dog, or think of your friend's dog, or think of somebody's dog down the road, and that dog sticks their head out the window. Well, modern vets describe that as oversensation. They get the sense of the wind on their face. They hear the sounds in their ears. They smell the smells of the world when your dog sticks your head out the window. But your dog can't do it forever. Eventually, they become overloaded and have to sit down, right? Well, this patient that's on the left here, he's become overwhelmed, or she's become overwhelmed. They've become overwhelmed. And now they have to take a moment of relaxation. They have to have a moment of chill out. So the patient's chilling. dad has decided, or caregiver, loved one, family member, baby daddy, I don't know, whatever they be, has decided that the patient is hurting themselves, so they are doing some slight restraining, which we're going to talk about in a minute. But this patient's having a meltdown and has become a threat to themselves. Now, patient on the right is actually a patient from East Tennessee. Oh, I'm so sorry, guys. Our EMS crew got to know her very well. Her brother works in EMS. Very, very unique family. They kind of crazy, but we love them. A lot of us on the squad that I worked for had been bitten by this one. She may look innocent, but she bites real bad. Part of the reason she bites is her brother taught her a biting game, and that's a form of communication for their family. So, two very different patients, but both do have severe autism spectrum disorder. Little girl on the right from our hometown has severe autism. She'll never live on her own. She'll never be able to have an apartment. She'll never have children. She will have a constant caregiver, and she may overlive her family. Well, here's another picture of her and some treatment thoughts for you guys. So when we're dealing with treatments for these patients, I have 3 cardinal words of wisdom. Be honest, be alert, stay calm, and try to be positive. A person with autism, if they could play poker, especially severe autism or detailed oriented types of autism, they would clean you out because they would know your tail in the first hand. So do your best to keep those 3 rules in your mind. If it's going to hurt, you tell them it's going to hurt. This is good general patient care, first off. But a person with autism, you've got to be honest, or you've destroyed trust. And you've not only destroyed trust for you, you've destroyed trust for any healthcare provider in the future. So keep that in mind. You do need to be alert. If family or caregivers on scene, hey, what do we need to be aware of? This is a good patient to have family in the back. I know we're COVID-19 freaked out and worried, but if this patient goes to hit you, I bet mom and dad will stop the hit before it even gets to your head because they are alert at all times. Stay calm and try to be positive. If you're worried, the patient's going to pick up on that, especially if they have autism, even if they're nonverbal. People make fun of me when I'm in the field. Even if I have a dead person, I talk to them. Hey, honey, we're going to move you today. This is Wesley. I'm here with the EMS service. I'm a paramedic, and they may be deader than a dang doornail, but I'm still going to talk to them because that is what I do as a caregiver. Now, I want you to remember something. Persons with autism, even if they're nonverbal, still know what's going on in the world. It's not time to talk about your Grey's Anatomy flings. It's time to talk to your patient and reassure your patient, even if they don't verbally give you communication back. In doing treatments, a big focus I want you to work on is do not interrupt repetitive behaviors unless it is necessary. Remember, we talked about those repetitive behaviors being a form of communication. So remember, your repetitive behaviors, when you stop them, you stop somebody from talking. If you were in the middle of a sentence and somebody put a hand over your mouth, that'd piss you off a little bit, wouldn't it? Please be patient. Breathe in, Jesus, blow out the devil. My Lord, I beg you to do it. Be patient. Be patient. Take a breath. You breathe in Jesus, you blow out the devil or whatever you believe in, don't believe in, I don't care, flying spaghetti monster, whomever. Breathe them in, blow them out. Take your time. This is going to be a long call. These persons have a very detailed schedule that they like to follow, even if they are nonverbal, and you are not a part of that schedule. So we should try our best to minimize stress. Well, what should we avoid? Well, calling 911 is the number one stressor that probably shouldn't have been done right at the first place. Well, the patient needed medical. Yes, 100% call 911. That's not what I'm saying. But there are certain things that we can do to help avoid stress. We can turn our radios down a little bit or put the earpiece in. Yes, your radios are your lifeline. I'm not saying get rid of your radios. I'm not saying turn your radios off. I'm saying turn them down. Imagine if you had a radio blaring on your hip, or God forbid you were Squirrely McGee and you had 45 radios on, because I know some of you do it. I ain't judging. I've been a squirrel, just squirreling. Just be cautious of that. Remember, you have pagers, radios, lights, sirens, what needs to be on, what has to be on. Make sure you're very conscientious about that. Changes in routine are awful, but do your best because, hey, we got to change this routine because you broke your arm, so we're going to take good care of you. Hey, we're changing your routine because of this. Communicate with the patient even if they are not verbal. Please try to limit physical contact, especially the neck or the head above all else. If you, as the provider, go out there, you're out there because the patient has become more aggressive, which does happen sometimes. And the parents are like, hey, we will help you any way we can. We strongly advise you do not do vitals because it really upsets my patient. Attempted vitals, patient's family noted that it was a bad idea, refuse them. That's what you put. And then be careful with your sensory stimulation. Lights and audible warning devices can be the devil to these patients. If they ain't got to go to the hospital, emergency traffic, don't take them emergency traffic. If you don't need the lights and sirens on scene, don't turn them on. If it's not, you leave the lights on. You've got to, it's your safety. Your life comes first every time. BSI Scene Safe is not just a national registry concept, my loves. This is a 24/7, 365 thing we should be living by. It should be our mantra, BSI Scene Safe. So be proud of it. Sorry, I got all excited. Southern Baptist there for a second. Now, continuing on with our treatment cycle, things you should be aware of 100%. Sorry, I was making sure I hit everything. We should avoid terms like the nasty word for Down syndrome people or people with developmental delays or you're not normal. First off, you a healthcare provider, if you're still using awful words that start with R, you need to reconsider your career field. It's not professional, even between you and your bromances or your girlmances, whatever you call those. Those are not cool. It's not funny. It's not great. It's a type of people. It's a group of people, and you are being nasty about them. And I really would not say those terms in front of a parent of a patient with autism or a caregiver because they're going to get down right nasty. And some of y'all live in redneck places like I grew up in. Your patient's family, they'll fist fight, you know, as well as I do. So don't even think it. I know Colorado Springs, they think they civilized. They got rednecks here too. They just call them something different. They smoke a little weed. They're a little more laid back. But don't get in fights with your families. Be respectful. The autism spectrum disorder can cause a patient to hide from first responders. So you may have to ask mom and dad, hey, where's our hidey hole? We got to find them. Fire, just so you're aware, can cause a patient to run towards it or flashing lights. So be careful with your trucks and your ambulances or your response cars or whatever you got, because the patient may be running towards you and they're like, oh, just hit that patient. Where'd they come from? They just ran out of nowhere. Be cautious. And once again, remember that radio can be terrifying. But your safety comes first. Seek out the caregiver's advice. Try to follow the caregiver's advice. They may have great tips and tricks to take care of the patient. They may have a bug out bag ready to go for the hospital, for the ER, just waiting for you. They will have a knowledge of history and meds that you would not even have thought of. Mom and dad can probably remember date, detail, time, why they had this surgery, why they had this procedure, why they did this, why they did that. Doctor down to the T, because they have to give the medical history so often. When possible, please allow the caregiver to ride in the back. This is something in EMS that we have always been really crappy about because the back's our office. We're doing our work. It's only for me. Nobody's fit. I don't care what your reason is. Comfort your patient. Take good care of your patient. This is good patient care to allow someone to ride in the back. Now, if they've lost their guard and they're having to come apart the size good Lord Almighty ain't ever seen, you ain't going to put them in the back. That's fine. I'm talking about family, not the patient. If the patient's having to come apart, try to let the family calm them. But if the family's having to come apart, yes, your safety comes first, 100%. But if you have a policy, nobody rides in the back of my ambulance, well, are you in the right field? Because you ain't doing the right thing for the patient sometimes. So definitely keep that in mind. Now, if the caregiver's not available, there's a couple of things we can try. We talked about looking at the scene, finding the imagery. There's 55 Barney dinosaurs. There's 1,000 ambulances in the house. They have ambulances from every make, model, size. And Johnny and Roy are on the bed from emergency. That's an old reference. If you know what that is, I'm very proud of you right now. I'm dating myself, even though I wasn't alive when it came out, thank God. But anyways, they're obsessed with EMS. Get them talking about EMS. They're obsessed with dinosaurs. Get them talking about dinosaurs. Now, what if that doesn't work? So you can't get their verbal fascination to help you. Um, there are some de-escalation tips we can try. Talking in a calm voice, being very open, sitting in the back, writing in complete silence, and not touching the patient. That is totally acceptable with a person with autism. I'm not saying you have to do that. You may be able to do a full assessment, do everything fine. But if the patient becomes hostile or upset when you touch them, we've done the best we can. There are no life threats. The patient has respirations of 16. I was allowed to take a pulse, or I put the heart monitor on real quick. I have a heart rate of 100. I did not do a blood pressure. Patients in no obvious distress called because they can't find the family. Patient was covered in feces. They wanted him to transport, whatever. You do what you have to do. Now, something you can try is you can take a blanket and two healthcare providers, and you can gently wrap that blanket from front to back. So you take the blanket with two providers and you come around their shoulders and you drape it. This provides a warmth and sensation that makes the patient feel comfortable. This does not have to be performed. It's not a restraint, so you ain't hog tying them with a blanket. You're just providing them a blanket that prevents them from swinging at you as easily and may provide them comfort. Um, if you have to use restraints, which does happen, my friends, persons with autism may need to be restrained. Just remember, patients with autism spectrum disorder may have distorted senses of pain. So a seatbelt that's loose may hurt, and a seatbelt that's too tight may be nothing, but it may be cutting into their skin, but they're not making a sound. So we have to check pulse, motor, sensory, CMS over and over again to make sure that we're not blocking anything off. We should always be able to fit a thumb or a finger into our restraints, so make those aware. Please look for those. Here's some resources for you if you're in the Colorado area. I do want to note that the Colorado Department of Education has the Exceptional Student Services Unit. And this is for disabled, gifted, and talented. So they get more funding, English as a second language learners. Really cool how the state of Colorado deals with that kind of world. There's another picture of our friend from Tennessee. Speaking of our friend from Tennessee and why I care, it's my sister. I taught her the biting game. My mother still hasn't forgiven me because we bite to this day. Miss Amber turned 21 a couple of days ago. Miss Amber was never supposed to live that long. My sister does have autism, but she also has another disease called tuberous sclerosis. But my sister is completely normal. She may not talk, but she communicates to us. I definitely advise you, if you have a person who has a sibling without autism, to use that sibling to your advantage, because I bet they have a super close relationship. My sister is the best part of my life. Bottom right hand corner is my middle sister and my youngest sister. That's us at the Special Olympics. We won gold. That was the year I got escorted out because they were using a pop gun to notify the start of the races. And me and my daddy got escorted out because we lost our minds. We had what we call a come apart in the South. We were allowed to come back when she won the gold, though. We were very proud. That Special Olympics, that means it's last place. So we were very proud of her. So thank you for letting me share a part of my life. There are some videos if you're ever interested. I'll make sure Mr. Schellenberger puts my email address on there. If you have any follow-up questions, I would love to share them with you. This is not how I like to give this lecture. I'm definitely love to give it in the room, show my videos, show my case studies, but I do hope you learned something, had some fun with it, and definitely are thinking a little different about how you deal with autism patients. They're good people. My sister is a great person, and she deserves your respect because she's had nothing but a fight to live for 21 years. So thank you guys for your time and attention. I'm going to go ahead and stop for now. You all have a great day.